frequently called a silent injury, as many as 3.8 million Americans sustain a concussion or mild traumatic brain injury each year. And while children and adolescents are vulnerable, playing team sports or in everyday recreational activities, concussions can happen to anyone, anywhere, at any time. Experts say even though the medical community has come a long way with understanding head injuries, there is still much to be learned.
A concussion is actually a metabolic injury. It's not a bleed on the brain or a bruise. It's actually similar to tapping a bowl full of jello if your brain is the jello. And the force wave sort of undulates through the brain, and all the nerve endings are also twisting. And as soon as they twist, they actually leak the ions that they need to neurotransmit. The treatment for a concussion has really changed in the last 5 or 6 years. Although we do still initially rest a patient, we don't extend that for a long period of time. 3 days or less is usually adequate, and then we try to get the patient back into their normal activities as soon as we can at a moderate pace, including aerobics as well as your cognitive work.
Experiencing an influx of patients coming to its urgent care locations for the treatment of head injuries, Righttime Medical Care saw the need for more in-depth education, evaluation, and treatment of MTBI throughout the communities they serve, leading to the 2012 launch of the HeadFirst Sports Injury and Concussion Care Program. This clinical team works with a collaboration of head injury specialists to determine the most appropriate personalized steps for a full recovery.
We are very dedicated to helping the community recognize and respond to the injury appropriately. So that's families, coaches, teachers. In pediatric head injury, only about 1/3 of the kids are actually coming from organized sports. It's really the dangerous game of childhood. So we really need a system that can attend to their issues and their injury also. It can't all be funneled through the athletic department to respond to head injuries in children. Likewise, in adults, we see car accidents, we see slips and falls on the ice, trips down the stairs. So it can really be any variety of causes for head injury. The recovery, however, is actually approached the same way. We do look at eyes, cognition, and balance. That's how we evaluate a patient. Then we decide what kind of rehab they need, whether or not they need any pharmacotherapy. How can we get them back to their active lifestyle in the safest way?
Founded in 1989 by trusted local physicians, Righttime Medical Care is celebrating 3 decades of simplifying access to trustworthy medical health care. Whether you're sick, injured, or have a concussion, you can walk in or call ahead to any of Rightime's many locations across Maryland every day of the year for the highest quality urgent care.
We've done our best to ensure that we help our patients with the complicated way of getting health care in our country. What we try to do is to make sure that our patients in our community can easily find us, can get access to us any day of the year with extended hours. And we found from our very beginning that we can serve our community best by seeing patients of all ages. We've created a number of new services that we feel separate us from our competitors and certainly serve our community. We've developed a telemedicine program. The patient can be at home, can be at their workplace, and still receive care from us. We have developed a communication resource center that tends to bring the operations of all of those widely spread centers together so that we can optimize the care and the service at any of those sites.
Today, HeadFirst Sports Injury and Concussion Care has evolved into one of the nation's largest community-based multi-location centers, educating, evaluating, and treating concussions in people of all ages.
I had 3 concussions where I was completely knocked out. That's what they tell me because after the first concussions, it's hard to remember the second and the third. I think today we take the cautious approach. There's still a lot of education that we have to do. We're trying to teach the best technique possible so we can take the best care of your children. And I take the careful approach to athletics now because I know it's not a sprint, it's a lifetime of activity, and I want it done technique perfect.
The most important thing is really to respond to the injury early. The majority of our patients recover very well and get back to their normal life without significant problems. Rely on your medical care provider to really help you through that.
I think based on our current platform and our current approach to what we do, we're poised for further growth, innovation, new services, new locations, and really demonstrating to our society the importance of urgent care and the importance of telemedicine and connecting patients with the healthcare system.
Patients deserve a complete, affordable alternative to the ER in a welcoming environment. Learn more today about Righttime Medical Care and HeadFirst Sports Injury and Concussion Care, celebrating 30 years of trusted healthcare for all ages. For more information, visit myrighttime.com or myheadfirst.com or call 888-808-6483.